Hey guys, and welcome to another episode of Brain and Spine. Today we're going to talk about Parkinson's disease. Parkinson's disease is a chronic degenerative condition of the central nervous system that affects the motor system. It was first described by James Parkinson, who noticed involuntary movement, reduced strength, a bent forward posture, and fascination. He identified these signs by observing 6 people in his neighbourhood. 60 years later, a French neurologist called Jean-Martin Charcot studied the condition further and named it after James Parkinson. It has risen in popularity since then due to Michael J. Fox, the actor who played the teenager in Back to the Future. He was diagnosed with Parkinson's at the early age of 29, and since then he has played a huge role in advocating a cure for the condition. So what is Parkinson's disease? It's a progressive neurological condition. People with Parkinson's do not have enough of the chemical dopamine. Dopamine acts as a neurotransmitter, sending messages to other nerve cells such as the motor control system and the reward system. It's produced in the substantia nigra, which is part of the basal ganglia. When nerve cells of this part of the brain die, the level of dopamine released is reduced, and gradually signs and symptoms of Parkinson's start to present itself. There are 2 types of symptom groups, motor and non-motor. The 3 main motor symptoms are, I remember these as the 3 S's just to make it a tad easier: shakiness or tremor, stiffness or rigidity, slowness or bradykinesia. With regards to rigidity, there are 2 types. There's lead pipe rigidity and there's cogwheel rigidity. Lead pipe rigidity is when an increase in muscle tone causes continuous resistance to passive movement without any fluctuations. Cogwheel rigidity is when there's jerky resistance to passive movement as muscles contract and relax. Some of the non-motor symptoms are problems with speech and swallowing, memory issues and constipation. Some of the other symptoms include fascination, a vacant expression, postural instability and even small handwriting. There are a few different types of Parkinson's. The most common is idiopathic Parkinson's disease. Idiopathic simply means the cause is unknown. Vascular Parkinson's occurs in those who have a restricted blood supply to the brain, and this generally occurs in older individuals who have diabetes, for example. Another type of Parkinson's is drug-induced Parkinsonism. This is when an individual presents with Parkinson's symptoms after taking medication that affects the action of dopamine. This effect generally lasts temporarily. Some recover from this within months, and some even recover from this within days. Rarer forms of Parkinson's are multiple system atrophy, MSA, which is when different areas of the brain become damaged, giving rise to Parkinson's symptoms, and also progressive supranuclear palsy, PSP, which is thought to be associated with the formation of protein clumps that causes damage to nerve cells. Unfortunately, it's quite difficult to differentiate between the different types. However, physicians attempt to do this by seeing how individuals respond to certain medication. So how can physiotherapy help? Well, in 2012, Tomlinson published a study that proved that physiotherapy does help those with Parkinson's disease. There are 4 stages: diagnosis, maintenance, advanced, and palliative. In the diagnosis stage, we can provide advice and education. Simple things to advise would be to continue doing their sports and hobbies, and even to take up new things such as tango dancing or tai chi. This will help to maintain their fitness levels, reduce progression of the condition, and also improve their quality of life. When the condition progresses, physio would move to ensuring the individual maintains his independence. This is done by providing a wide range of support from either social services or even asking family members to assist. During the palliative stages, physio may help to prevent any pressure sores or even to treat any chest conditions. The progression of Parkinson's disease varies between each individual. For some, it goes quickly. For others, it may take some time. However, as physios, it's our job to ensure we provide a patient-centered approach that encompasses what the patient wants and what's best for the patient. That's it for today, people. Take care, and I'll see you later.